Hello and welcome to my channel Health and Wellness with Emma Mentel. Today I'm going to do a short video about the thyroid gland located here in the throat area, thyroid health, and something that so many people talk about, that I hear so often in conversations. And I know one of the conditions that receives a lot of attention from a medical perspective, but I think there's so much more that can be done to support thyroid health and to improve and optimize the working of this incredibly sophisticated gland as part of the endocrine system. Thank you for watching. Thank you for subscribing. Please comment, please share. And I hope you find today's short clip interesting and informative. So when I think about the thyroid, it's a tiny, small gland, a sort of butterfly shaped gland in the throat area. And I try to always think of the endocrine system, everything where hormones are involved, as like an orchestra. And each of the parts are so important. So in the endocrine system, anything to do with hormones, whether it's thyroid or adrenals or ovaries, the pancreas, anything hormonally related, whether it's the hypothalamus, pituitary, everything works together. And when there's one area that starts to get out of balance or out of sync, then everything else has to adjust. So nothing happens in isolation. And very often in Western medicine or in modern medicine, symptoms are taken sort of in isolation, and that gets treated. And there are, a lot of brilliant practitioners, but I've also really been quite disappointed and disillusioned when I see how something like thyroid health is approached as a one-sided approach, but not considering anything else. So let's first look at some of the main symptoms from someone who perhaps have got low thyroid function, hypothyroidism. So the thyroid is not performing at its peak, it's under functioning. There's of course many variations in terms of thyroid diagnoses, and each individual will be different. But if we just look at one of the very common diagnosis, which is called hypothyroidism, and the symptoms that are mentioned would often be somebody who feels sluggish, especially in the morning, that morning fatigue, fatigue upon waking. It seems to improve as the day goes on. Dry skin, prone to constipation, but not always. And these people tend to be quite cold. They feel the cold easily because it's like the thermostat of the body is not working the way it should. So these are just some of the symptoms, but of course not everybody is going to present clinically exactly the same. And to get an idea and to be able to diagnose where this has gone wrong, one would have to do blood tests to look at TSH, thyroid stimulating hormone, a T3, a T4, but this is often where a thyroid profile testing stops. Most doctors would just look at those three and nothing more. I've always insisted that one also looks at thyroid antibodies. Now, in autoimmune conditions with the thyroid, one would expect to see an increase in thyroid antibodies. And it doesn't always present the way that doctors have been taught, like a clinical thyroiditis. But it can be very subtle and it can almost seem hidden. So some of the readings might seem okay, nothing out of the ordinary. But then when you're looking at thyroid antibodies in the same thyroid profile test, you would find that these are elevated. And without going into too much detail, this would tell me that there's almost something that works against the thyroid's own working. Any attempt that we are making at correcting these hormones will be undone by these thyroid antibodies. Now, thyroid autoimmune conditions is something that a lot of people come and talk to me about. It seems to be really common, and people think, well, this is now what I have. What's been very interesting for me, and again from somebody who really inspired me to learn more about nutritional therapy, Patrick Holford, many years ago, used to often mention at the time, and I still advise the same because I find it really makes a difference, that when you're testing a profile for thyroid hormones or thyroid health, always include thyroid antibodies. Again, once you've now identified that thyroid antibodies might be part of the pieces of the puzzle that are missing, there's so much that one can do to restore this, and I've seen it with my own eyes. Gut health, interestingly enough, because it's associated with so many things in the body, is very involved. And we see that gluten, the wheat, rye, barley, and oats, gluten will undermine the function of the thyroid. And very often when somebody includes gluten or eats gluten, they eat bread, biscuits, cakes, pasta, all the kind of things made with flour or with wheat. If you then see that there's a problem with thyroid antibodies, one of the first steps is to clean up the diet and look at gut health. There is another video, the 5R of gut health and gut restoration. So you must go and listen to that. It's relevant even in thyroid health. So by cleaning up the diet, removing gluten from the diet, restoring gut health will ultimately also improve thyroid function. These things are not separate. And gut health is not something that works here on its own and thyroid health here somewhere else on its own. And I find that really encouraging to know that by treating any gut condition and by cleaning up the diet, removing the gluten, any other foods, by really looking at nutrition and by making sure that somebody improves their nutritional health, that you could also improve their thyroid function. Isn't that fantastic? It's such good news. So one doesn't just have to rely on thyroid hormones prescribed by doctors or endocrinologists or physicians, even though it is often necessary and you should be speaking to somebody like that. But don't see that as something that happens on its own and that you don't have to clean up your diet, because nothing will correct to any kind of optimal level unless we address all of these factors, and then the rest of the body can also improve. Low thyroid function is a risk factor for a whole lot of things. So I would say one should look at it and one should make sure that you address it and find some kind of a protocol or strategy that will be supportive. I spoke about fatigue yesterday, treating fatigue, dealing with fatigue, preventing burnout. And again, because the endocrine system is like this orchestra where every instrument plays such an important role. And if somebody is fatigued, burnt out, really been tired for a long time, it's going to impact on thyroid health. So again, if one wants to get thyroid health to be more optimal, you would want to also address fatigue. You would want to also address stress and stress management, and getting the body to where it will be able to adapt better to stress, because then you've got two things that can work better harmoniously, and the one can help to restore the other. So the one doesn't happen on its own and the other one in isolation. These can work together, and the more you pay attention to both, the faster you're going to feel improvement. Some of the main nutrients that one would consider would be selenium for thyroid health. Also your other minerals, something like iodine. Iodine, I think, is quite a big deficiency for many people, but of course there's iodine sensitivity or iodine allergy. So you would have to speak to a professional or a practitioner who's knowledgeable if you want to supplement with that. But I think it's a supplement that really can do a lot of good. The other nutrients as well, zinc, other minerals, other vitamins, but again, I wouldn't supplement with a standalone nutrient. Maybe add selenium to a combination of the foundation approach of multivitamin, good Bs, your minerals, your omega-3, whatever else is going on, and then maybe top up with selenium until you've addressed all the factors that might have depleted your thyroid health. And then something that I always discuss with my private clients and that I want people to acknowledge is, again, because we're physical, mental, emotional, and spiritual beings, these things are all a blend of everything else. This area of the throat, if there's any restriction here for a woman or a man, and we are working on trying to restore thyroid health, I also want to go and look at what this area symbolizes. What is the theme around our throat? And it's quite a simple one. It's our voice. It is to be heard. It's when we speak, we want to be heard. We want to know that our voice is important. And there are certain affirmations that I will get clients to use. I also like to refer to Louise Hay's work, how the mind and the body work together, and to find some kind of an affirmation that the client can relate to and that they can start using on their own personal journey to restore thyroid health. So for me, it's also about creativity and being able to express yourself. So if a client finds it particularly difficult to express herself, if she finds it difficult to find her own voice in a situation, I would then recommend that she considers something like journaling, writing down what she feels. So that's at least a way to clear out any restriction or stuckness that might be sit here, something that you want to say but you just can't say it. And then of course something vibrational that I think is so important for the health of our throat, and therefore all the organs and even the neck. You know, if there's restriction in the neck, there's typically also restriction here. So these things work together. Singing, chanting, even screaming. You don't want to just scream in the house and give other people a fright. But if you feel you're very frustrated and you just can't say what you want to say, you might want to take a drive or scream into a pillow and just find that there's a way to release everything that you've been holding in here and that it can't be said. Maybe it's a secret. Maybe it's something you don't feel comfortable talking about. And this is what I find so fascinating and incredible about the approach that considers everything. All the information is significant. This part of the information about the voice is not less important than the gut health. It's not less important or significant than taking the thyroid hormone or getting the results of the blood test and being able to interpret that. And usually we are a blend of all these different things. So that's thyroid health. Your voice is necessary. You want to be heard. Your voice is important. And then of course the gut health and the other factors. Thank you for listening. I hope you found this interesting. Please leave a comment and please share this if you think that somebody might benefit from this information.